Magandang hapon po. Palagay ko daw kasi pinanood na rin nila yung iyong ano ng Yin and Yang. Kung napanood po nila yun, talagang andun na lahat yung explanation eh. So parang review tayo. Kaya simpleng review po itong ano po natin. Magandang panoorin po natin yung kay Doc. Okay po. So yung topic po natin ay ang Yin and Yang. Tingnan po natin ano ba yung Yin and Yang. Well, meron na tayong idea dito dahil napanood na natin ang mga video ni Doc. So Yin and Yang, the duality and the unity of opposites. Pero titingnan po natin yung sign, ano, saan kaya galing yan? Ba't may ganyan? Nung una ako nakita, sabi ko, wow, ang ganda. So yung ano pong yan, sign of Tai Chi. Siyempre sa China, ito yung cosmological term for supreme ultimate, the great ultimate. So yun po yung symbol niya. The duality and the unity of opposites, ano po yung ibig sabihin nun? Sa drawing pa lang, makikita na natin na, no? So, everything is composed of yin and yang in various proportion. Kaya, ayun po, di ba yung yin, yung dark side, meron siyang light, orange ba to? Orange. At yung orange, meron ding black. So, ibig sabihin, lahat ng bagay, aspeto, meron ang bawat isa, may yin and yang. Tapos, syempre yung ano yan, yung everything is composed of yin and yang in a various proportion. Yun po yung pinapakita ng drawing. Limbawa po dyan, di ba? May male energy, may female energy. Pag male energy yang, pag female energy yin. Kahit babae tayo, meron tayong pagka-yang, may male energy tayo. Ganun din yung mga lalaki, may female energy. So kahit opposite, meron ka nun. Dadagdag ka lang po, Doc, ha?
Sige po, sige po.
So the symbol is visual depiction of the intertwined duality of all things in nature. So yung intertwined, ibig sabihin nun hindi talaga pwedeng maghiwalay. Connected siya, difficult to separate. Yun ang ibig sabihin nitong drawing na ito, na symbol. Hindi pwede silang maghiwalay. So, intertwined duality of all things in nature. Hindi natin po mamaya, mas mapapalalim yung ibig sabihin yan. Ayan po ano. So, the meaning of yin and yang symbol, there is duality in everything. So, sa lahat daw ng bagay, sa lahat ng aspeto sa mundo, merong duality ng yang and yin. O, tingnan natin yung yang. So, yung yang is male energy. Ang yang po, di ba, yung puti. At ang yin ay yung dark. May male energy. Anong katapat niya male energy? Female energy sa yin. Yung active sa yin is passive. Light, palagay ko nagkabaliktad. So, sa yang light, sa yin is dark. Sa yang is dominating, sa yin is intuitive. Sa yang is strong, sa yin is stillness. Hindi lang po nagkatapat-tapat, ano. Sa yang yung movement, tama po ba? Movement, yung gumagalaw, hindi gumagalaw, stillness. Hot, cold, sa yin. Sa yang, expanding, sa yin is contracting. So yung outer circle represent the universe in everything in it. Yung paano, yung bilog. Yung small inner circle represent that everything carries the seed of its opposite. Yon, yung maliliit na itim sa puti at puti sa itim. Yan. Pag tinignan po natin yung drawing, ma-analyze natin. Okay, next slide po. So yung yin, sabi nga natin yung yin, siya yung black ano. Ito yung cold, passive, wet, night, solid, dull, constant, descending, contracting, nutrition, substance. So ang opposite nito ay yung yang. Kung may cold, syempre may hot, passive, active, wet is dry, yin deficient. Night, day, solid, hollow, dull, bright, severe, constant changing, descending, ascending, contracting, dispersing, nutrition, protection, substance, yun yung function niya. Okay, pag may tanong po magtanong lang po, may dagdag. Next is, ayan, mas madali na maintindihan. Siyempre yung yang is sun, day, summer, fire, upward, dry. Sa yin is water, moon, wet, night, downward, winter. Basta kung titingnan po natin yan, opposite yan, yung magkaka-opposite. May naisip po ba kayong bagay na walang ka-opposite? Meron po ba? Sige nga po, ilan ba tayong nakikinig ngayon? 7. Sino po kaya, may naisip po kayong bagay na walang ka-opposite? Hello po? Hello po?
So far, wala
Hello?
pa. Ewan ko sa iba.
Wala po siguro talaga nag-isip ako, mukhang wala talagang bagay na walang ka-opposite. Kasi hindi natin malalaman yung ganda ng isang bagay kung wala yung opposite niya. Diba, Dok? Hindi natin malalaman kung walang opposite. Hindi natin alam na may maganda kung walang pangit. Parang ganun po. Kaya napakahalaga yun yung opposition ng bawat isa. Next po. So, yin and yang. One extreme will always change into its opposite. So that extreme yang turn into yin and vice versa. Ayun po yung sa drawing So once na tapos yung yin and yang consume and support each other and are usually held in balance. As one increase, the other decrease. Yan yung sa drawing po kaya yung dulo ng black is maliit. Yung white, nagsimula siyang malaki para balance siya. Tapos pag yung dulo naman ng white, maliit, yung black ang malaki. Para magkaroon siya ng balanse. Parang nag-giveaway. Ano po, Dok?
Yeah, ma'am, you were asking something kanina.
Opo, Dok.
Sabi niya, one extreme will change into its opposite. And this is intertransformation, right? O mali?
Opo.
Okay. Can you give an example ng intertransformation, how it happens? Para lalo namin maintindihan.
Pag nag-o-opposite na yung mo sa katawan, yung
No, you give an exact isang example lamang, wag yung mga pangyayari talaga.
Ang sa akin po sa physical na katawan po, pag sobra nang na-consume yung yin, ang mararamdaman na halos mauubos yung yin, maghihit ka na Lilipat ka na.
Example nga example nun. Anong mga example? Anong mga condition? Ganun, para lalo na
pag matinding fever, ang kasunod minsan nag-chill ka na. Kasi na-consume na yung heat mo, na-consume na po, so cold na po yung papalit. Sa physical po yung nararamdaman ko. O baka po yung iba may addition sa tanong ni Doc na mga experiences na extreme yang turn into opposite. Vice versa. Doc Hex, baka... Sige po.
No, can you give another example?
Opposite, so the extreme yang turns into yin. Ano pa kaya?
Intertransformation. Kasi yun ang hindi ko maintindihan masyado
Sa intertransformation. Doc Hector, baka po may dagdag kayo.
Alam mo yan, di ba? I think that's a given. When you say intertransformation, what you were not before, you become that. For example, yung ice, does it remain ice forever? Ice is cold and solid. So, once na-achieve na niya yung magta-transform siya eventually into liquid. And hindi naman siya forever malamig. Ganun lang po yun. And once the extreme is reached, kung titingnan mo mabuti, it will now change into its opposite. So for example, we see a patient with kasi before it does that, there is always an attempt to balance it. A very good example is yung fever. Bakit ba tayo nagsisweat pag may fever? Because normally, when you have high temperature, that means too much yang, it will always be opposed by yin. No? Now, it's another story when the yang is there forever. Like example, parati kang exposed environment where you are kasi like the more often ka ma-exposed, especially pag deficient ka, the more ka madadala. Kasi the idea there is balance, no? So if you did not if you have more of one, you will have less of the other one. So ang dyan is yung sobra before can actually become less. So when that less will be partnered by the one that became more, which was previously less. Ewan ko kung naintindihan na. And meron din tayong support. So they consume also each other. No? So they don't only consume each other, they also support each other. So nandoon talaga sila. They are usually held in balance. If ibig sabihin, if one increases, the other one is decreasing. No? Yun.
Yes po.
Di ba yung saan ba mas masakit ang pain, ma'am Mildred?
Sa
When
yin
you
po.
experience it for the first time? They say when you have
First time po,
injury. Or
pakiramdam, Doc, sa pakiramdam po, kung alin ang mas
acute
masakit.
and chronic. Can you compare acute and chronic?
Minsan po mas acute. Mas masakit ang acute.
Bakit minsan? Is there a possibility hindi siya masakit?
Sa experience po, kasi parang yung acute, parang pag may acute condition ka, parang bigla mong naramdaman, then hindi naka-prepare yung katawan mo doon.
So pwede ba
parang
natin?
talagang, pag chronic na, parang nasanay yung katawan mo.
So alin po sa dalawa? So ang kino-compare natin ng acute and excess, acute and chronic. So it's just like comparing excess and deficiency. So ang tanong, saan po doon ang deficiency?
Yung excess po masakit. Pero sa akin po, pag nagsisimula ang sakit, yung po sa acute, mas masakit ang acute.
Kasi bago.
Opo. Hindi pa nakaano yung katawan mo eh. Pero pag naka-adjust na kasi, parang nasanay na, hindi na masakit.
Kasi we need to know this. Kasi this is basically what we're doing. If there is too much of yang, obviously, there will be less of yin. But the question is, what are you going to do? Are you going to decrease the yang and at the same time increase the yin? Or what?
Yes po, yung excess, babawasan mo po. Kasi yun ang nagko-cause nung
For example, kasi most of the cases you see in the clinic is a combination of excess and deficient. Diba? For example, saan ba nagmumula ang phlegm? Phlegm is excess. So internal. So ano ba siya dati? Deficiency. Spleen yang or spleen qi deficiency. So ang tanong, ano bang una mong gagamutin? Yung excess or yung deficient? Or will you treat both?
Kung i-pattern with mo po at pinagmumula talaga dun sa deficiency, kaya siya nagiging excess, yung deficient po muna.
So ibig sabihin ko ang daming plema sa ayusin mo kasi it will take a long time for you to treat a deficiency condition. Another example, if you have asthma, inaatake na siya, hindi na siya makahinga. Sumisikip na yung dibdib niya sa dami ng phlegmas. What are you going to do? Are you going to treat
Kailangan makahinga muna. Depende po siguro dun sa situation ng papi talaga. Parang ititreat mo muna yung chief complaint niya.
Ano ba ang gagawin? Are you going to treat the excess first by sedating? Obviously, you have to sedate. Or
yes.
Will you be doing both? Depende sa situation.
Opo.
So I think
may pasyente din pwede mong pagsabayin. May pasyente din naman na kung mahina talaga yung chin, hindi mo pwedeng pagsabayin. Tanggalin mo muna yung excess, tsaka palakasin mo siya.
Example, meron kang pasyente na I think this usually happens. Ito yung tinatawag na heat above, cold below. Yung mukha niya mapula. Pero yung paa niya malamig. So what will be your deciding factor? What are you going to do? Kasi syempre, meron kang mapula yung mukha, isipin mo yun yang na yang. Ang problema, yung paa niya malamig. So anong gagawin mo? What will guide you as to what to do? Anyone, Ma'am Needs? Can you tell us? You know, that's very common. Yung mukha niya mapula, complaining of a lot of things, pero yung paa niya malamig. So we're looking at ano bang gagawin natin? Or what will guide you in your decision?
Dok, tatanungin natin yung patient, ano ba talaga yung nararamdaman niyang gusto niya matanggal sa katawan niya. For example, giniginaw siya, di ba? Di pa iinitin mo muna siya bago mo siya
No, I think ang gusto mo niyang ayusin mo lahat eh. 'Di ba? Kung magbabayad naman siya sa iyo, gusto niya mawala yung init niya sa mukha, mawala din yung lamig niya. Ang kasi niya, decision will depend on you. You just don't, of course you want the best for the patient, but the question is, what will guide you? What will be your parameter? Kasi nakasalalay sa yung pasyente, hindi naman ma-deprive yung pasyente. Ano ba yung talagang magiging basehan?
Balance mo siya. Kailangan may balance.
Siyempre, di ba, tatanungin natin siya kung ano ba yung, if ever na na-decide mo na may high blood siya, for example, hypertension, adi, titreat mo muna yung hypertension niya, and then, tsaka mo siya, papalakasin yung katawan niya.
Oo, pero yung situation kasi natin, mainit yung mukha niya pula, pero yung paa niya malamig. Very common po ito.
Oo. Wala pa ako masyadong na ganyan.
Organ involved, Doc, dapat makita po natin.
I think you have to look at the tongue. That will be your...
Yeah, sir. Doc, tongue muna.
And of course, the pulse. The pulse naman is not too reliable.
Yeah.
Yung pulse kasi mas recent eh.
Doc, minsan kasi medyo pagka tinignan mo yung dila, makukonfuse ka. Kasi ako pag heat or cold lang eh. So, pagka medyo confusing yung dila niya, parang medyo, minsan parang normal naman. Pero pag tinignan mo yung kanyang pulse, mabagal. So, parang hindi siya tugma dun sa So, ginagawa ko, ini-air ako, ko lang muna. And then,
so usually, inaayos muna natin yung excess. Aalisin. Kasi it's easier to dissipate. It's easier to sedate.
Yes, Doc.
No? Diba kasi kamamaya lalong lumala.
No. Medyo confusing.
Anyway, actually this is a challenge. No, this will actually determine how good you are as a clinician. Ang importante, nakita mo, may improvement naman sa pulse. No? Because there will be times when you don't exactly know what to do.
Yes, it happened.
Yeah.
Parang malilito ka.
And I tell you, I have to be honest, you usually see combination. So, you need to know the pathology, paano nagkaroon siya ng dampness. And let me tell you, it all started out as a deficiency. Unresolved deficiency takes years, several years para maging empty heat. And then there's the magaganon. Kaya pareho din sinasabi dito. Yun ang tinatawag na mag-i-evolve talaga siya. Kung ano siya dati, mag-iibang anyo. So it's like, ganun lang. Can we move to the next slide? I think this is very easy, Ma'am Mildred.
Okay na po, Doc. Dun sa tanong ninyo, si Doc po ang nagtanong kanina. Para may dagdag lang ako, Doc, na.
Ano yung example na
Opo, may
nag-transport? Actually, that will be one of the topics that we shall be taking up. So this is going to be a long one. I feel kasi that kahit yin and yang yan, a lot of people are thinking they already know so much without realizing that when you do pattern weaving, pattern differentiation, you still go back to yin and yang. Right? Yeah. A very good example is a deficiency condition turning into excess, which is very common. Spleen qi deficiency, spleen yang deficiency becomes dampness. Then magiging damp heat na naman, patuloy-tuloy. Tuloy-tuloy. Okay, so can we
yung
go?
isang simpleng ano din, Doc, na naisip ko, di ba, yung sun, pag ano siya, pag sa umaga hanggang tataas siya, then bababa, magiging gabi na naman. Pero nag-extreme heat siya kasi naabot niya yung nakaikot yung sun. Tapos magiging gabi na naman, tapos mag-uumaga na naman. Sa tao din naman po, mula sa pagtanda, magiging bata. Mula sa pagiging bata, tatanda. Tapos magkakaroon ng ipapanganak mula sa bata, tatanda uli. So, cycle din. Parang ganun din po yan. Ano, Doc? Bukod sa
Yeah, and then ganito kasi, actually ang yin nag-uumpisa 3 p.m. So ito yung time na mas maliit pa yung yin, then palaki ng palaki hanggang sa umabot siya ng 3 a.m. 3 a.m. onwards, nagyayang na naman siya. Ganun lang yan, patuloy-tuloy. Tuloy-tuloy. So let's continue. Now we go to clinical symptoms according to yin and yang. Now, that is what...
Yes,
Can I ask some questions?
Yeah, please, sir.
In regarding to our phenomenon today, if you are aware, regarding sun very far from the earth, no? So, based dun sa discussion natin na earth, yung 3 a.m. na mas malamig, ngayon kasi mayroon tayong phenomenon na mas lalamig sa ngayon. So, I raise this question because somehow, it will trigger our flu somehow. So ano yung magiging treatment po natin dito sa case ngayon ng mga tao na ito nga po magiging yung may flu na siya or ito magkakaroon pa ng nahihirapan maghinga. So shorten of breath. So yung po yung case po ngayon, yung phenomenal po ngayon, hanggang dyan po kasi ito medyo matagal-tagal din. Bakit po ba tayo doon sa phenomenal? So yung discussion po natin, di ba yung yin and yang? Kung ang yang po ay yung araw malayo sa earth, so magiging malamig po siya talaga. So meron mo ba itong parang ano ba to? What do you call it? Questions? Significance discussions? Parang ganun.
Yeah.
Yeah.
Yun ang po yung tanong.
Tanong po
Kinalaman yung layo ng Earth sa sun.
Oo. Di ba yung natin, left and right natin dito, di ba? Ito naman, parang invoicing, parang ini-invoice ng sun yung pagkakalayo niya sa Earth. Papalayo pala siya, papalayo. So may significant po ba ito sa atin sa practice of TCM?
Anong sagot niyo, Ma'am Mildred? Hindi ko rin alam yung sagot.
Kasi, yun nga, kung lumalayo po yung sun sa atin, so mas lamig ang mararamdaman. Ibig sabihin, yung mga pasyente natin, makaka-encounter talaga tayong maraming lamig ang katawan. Tulad dito po sa amin ngayon, ang daming may ubo. So pag tinitingnan ko po yung dila, talagang cold. Kaya gumagamit po ako ng moxa para ihit talaga sila.
Okay. Yun po.
Siyempre yung po natin na nagbibigay ng init, gagamitin po natin yun. Saka yung mga advices natin, napakahalaga po yun. Para
Yes.
uminit.
Opo. Sorry po sa tanong nga, medyo malayo yata yung question ko.
Yeah. Baka pagtanong ako sa nagtanong.
Sorry po. Ay, okay. Gawin na.
Yeah.
Gawin na.
Tungkol sa intertransformation ng yin and yang. Kasi po ang pinag-uusapan natin, intertransformation. Ang connection nun.
Ay, nawala po.
Sorry nga po, kaya nga po inaano ko po kung
Okay,
meron
okay
po
lang.
relation.
Okay lang.
Opo. Sorry
Ganito
po, sorry
yun.
po.
Yung pag ba nagda-transform ka, nagiging trans ka, o di ba? Example, grabe na yung pagka-young mo. Oh. Ewan ko lang
Yun
nga
nga
kung totoo to. Minsan kasi pag pag medyo naubos na yung, yung sobra mong young, there is no other way but go down. So this time, yun na, magtatransform na siya. Yung, di ba sinabi kanina sa earlier slide, before siya magtatransform, kailangan maabot niya yung pinaka-extreme. So we're looking at sobrang young, and then pag naabot na niya yung zenith, yung pinakadulo, it will start receding. Samantalang kaisa. So relatively, yung opposite na sign will go up. So that's the intertransformation. Actually, there's a lot of things that we have to study, no? And I find that this is very useful. Merong contradiction. I'm sure maraming alam dyan si Ma'am Mildred.
Ma'am Mildred.
Okay. Dito makikita nyo, passive active. So, yung isang tao,
symptoms po natin.
sige, i-ano nyo, ma'am.
Tingnan po natin yung clinical symptoms. Napakahalaga po sa ating mga manggagamit yan.
I'll give another example. Magbibigay po ng example. I don't know if it's going to be relevant. A person on drugs is being stimulated. Hindi po ba? Hyper na hyper siya. Pero yung pag-hyper niya, nauubos. He is young on that when he is hyper. But then, nauubos yung kanyang pagka-hyper, nalalata na siya afterwards. And I think that is the transformation, intertransformation sa young naging yin.
Yes, Doc.
Yeah.
O kaya naman, yung isang tao, malungkot na malungkot, namatayan ng pusa. Tapos sa paglalakad niya, nakakita siya ng aso. Bigla siyang sumaya. Intertransformation din yan from yin to yang. Malungkot, naging masaya.
Yes, Doc.
Yun lang po.
Ay, salamat, Doc. Oo. So, actually, napakaano po ito. Kaya kailangan malaman natin yung timing. Yung kung kailan siya nag-transform. Yeah. Salamat po for sharing, Dr. Gavino. Let's continue, Ma'am Mildred.
Okay po. So, sa yin po, makikita natin yung ng cold. Sa yang, yun, laging heat. So, feeling of cold, pag yin. Sa heat, inflammation, feeling of hot. So, symptoms of disease worsen when cold and improves with heat. So, alam natin na cold yun. Pag symptoms of disease naman, worsen with heat and improves with cold. Sa heat yun. Pale or blue complexion, cold. Red complexion, heat. So, sa attitude naman po, yun? Passive, active. Hypoactive organ, example, bradycardia. Ano yun, Doc? Yung bradycardia, hindi ko na-research. Pag hyperactive naman,
example niyan, may mabagal yung heart.
okay po. So, kabaliktaran niya itong hyperactive organ,
Tachycardia.
Tachycardia. Tachycardia.
Tachycardia. Kung mabagal yung isa, ibig sabihin mabilis naman ito.
Opo.
Opo.
Hmm.
So, dahil introvert person, ang kabaliktaran nito ay restlessness, extrovert person. Then, symptoms worsening during rest and improving during activity. Pag sa cold. Pag sa heat naman, symptoms worsening during activity and improving during rest.
Yes.
So, talagang
Ang dami, di ba? I think super clear na po ito.
Ayan na, makikita na natin lahat. So, pag yin, wet. Pag yang is dry. So, may edema, mucus, excess fluid. Pag sa dry naman, deficient yin, dryness of skin, hair, mucus, and membrane. So, symptoms that worsen in humid weather and improve in dry weather. So, pag sa ano ng yang, brittleness of nails, tendon, and bones. Symptoms worsen in dry weather and improve in humid weather. Sa night naman ang yin at yang ay day. Sa night, symptom that start in the evening and worsen through the night and are better in the daytime. So alam natin pag yin, pag sa gabi mas masumpong siya, yin talaga siya. So kabaliktaran niya, symptom that start in the morning and worsen up to noon, then improve in the evenings. Descending and ascending. Symptom that manifest initially in the lower body or limbs, perineum, legs, feet, example, edema, joints, pain, etc. Kasi alam naman natin na ang yin ay nasa baba at ay ang yang yung mga upper parts natin. So, symptom that manifest initially in the highest part of the body, head and neck, or limbs, arms, hand. Example, hot flashes, neck tension, headache. So, alam natin kung yang or yin pag nakita natin yung mga parts na yon. So, pag sa yin, there is contracting. Pag sa yang, dispersing. So, pag contracting, movement from outward to inwards. Dispersing, movement from inwards to outwards. Example, sweating. Climatic factors causing internal symptoms such as joints pains and arthritis in cold weather. Pag sa dispersing, extension or aching po ba to? Aching back, opistotonus.
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 That's
So, yes, Doc?
arching back.
Arching arching
Parang
back. Ano ibig sabihin nun, Doc, yung opistotonus?
Yung naka-hyperextend yung ulo mo papunta sa likod. Tapos yung
Yeah.
i-google niyo.
Hindi ko na-google kanina. So, sa contracting, dahil contracting may cramps, yung muscle tension in cold weather. So, pag sa dispersing naman, interior causes showing external symptoms. Urticaria after eating shellfish. Yung mga yung mga parang nag-allergy po ito So, contracted or Hans appearance. So, basta lahat na may contracting problem ay nasa yin. Yin po siya. Yun ang mga keyword natin dyan. Okay po? So, yin and yang nutrition, sa yin, nutrition, sa yang is protection. Parang yung function po ito, nutritional state of tissue. So, sa yin. Thin, fragile skin. So, pag mababa ang langin natin, tiyak, thick and oily ang skin natin. Tama po ba? Hindi. Pag thin, fragile ang skin natin ay deficient ang yin ng lungs. Pag thick and oily ang skin natin, increase yung yin o excess ang kanyang yin. So, yun yung mga sign.
Can I interrupt? This is very important, especially if you want to, to improve your skin. Di ba yung iba kung ano lang mga lotion pinaglalagay, walang kwenta.
Opo.
You need to determine, lang yin is decreased or lang yin is increased. So when you're looking at a very fragile skin, parang tissue paper.
Deficient.
Yeah, very, very you have to tonify the lung yin. So you have to look for, you know, you need to know the points. Now, on the other hand, if you have a skin that's so, that's so makapal, very leather-like, and then medyo, yung parang mapapaiw ka kasi may lumalabas na oil, that's the opposite. That means you have too much dampness. There is too much yin of the lung. Okay? And you would know what to do.
Treat the dampness in the lungs.
Yeah.
Okay po.
Eliminate the
Alam na nga po yun.
No, actually, you don't. I think the only way you could treat the lung yin, to decrease the lung yin, is to actually help out, do something with the spleen. Diba?
Yes po. Sa kanilang relationship.
O yung diet niya, ayusin.
Baka ang
So,
hilig-hilig
dalawa
nito
lang
kumain
yan eh.
ng mga matataba.
It's either very fragile yung skin niya, parang tissue paper, or masyadong makapal, tapos may lumalabas na oil. Okay?
Yung mga pimples, Doc, di ba? Example niyan.
Yes, yeah. There's too much dampness, pimples.
From the spleen.
You know what to
Then,
do.
opo.
Diba? You do spleen 9 because you want to eliminate the dampness. That's how it should be.
Tapos, yes po.
So pag hindi ka magaling, nakatutok ko lang sa muka. Di ba, Sir Michael? Sir Michael, are you learning?
Opo, opo.
So, ititreat po natin dun yung
Pag
ano.
medyo
sir.
mediocre ang practice, when they look at the skin, they will puncture the face or whatever. That's actually stupid. You have to look at the etiology. Then look at the tongue if it confirms your diagnosis. Sadly, not everybody's doing that. Hindi pa nag-a-attend ng Zoom. Okay. So,
Karaniwang pag ganyan, Doc, titingnan mo talaga yung spleen at saka lungs kasi yung
oo
skin
naman, ganun na
under
matalino.
ng lungs.
Diba? Ibig sabihin, tutusukin mo yung mukha kaagad, puro nga mga ano na yun, bulutong na yung mukha niya. What's the point?
Circulate lang po niya, pero
Find that
hindi
very...
mawawala.
Then you have to look at ano ba pinagkakain ito. And this is the time to really test your mettle as a practitioner, as a diagnostician.
Hindi lang pwede, Doc, na i-aculip mo yan para gumanda at mawala, kundi talaga yung organ ang pupuntahan.
Oo, kaya nga when you do aculift,
Tama.
aculift kasi, we treat the cause. We don't exactly just,
Yes po.
needle the face. That's what makes it different from other mediocre facial whatever. Diba? Yan ang responsible practice. Okay?
Okay po?
Sige.
Okay po.
Sige.
So, naintindihan mo na, Sir Michael?
Opo, kaya po, lalo kong gagwapo nito.
Okay. Nakaka-relate ka. Joke lang. Sorry. No, minsan kasi, there are so many things that will cause your, the dampness. Alam mo ba, too much thinking, this will deplete your chi. Let's say, you cannot help it, but sometimes things happen.
Opo.
Hindi naman perfect ang buhay natin, di ba? And so, it's just that so there are some people, they should not be affected. They're not allowed to be affected. And nobody even advised them to move forward, di ba? Alam nga naman, hindi ka magre-react sa problema mo. Okay? Ganun lang yon. Kaya, we need to really educate people to do acupuncture at least once a month or twice a month.
And watch
And they should
YouTube.
only go to people who really know what they're doing.
Yes.
And before you... Hindi, wag na. Next.
Sige, Doc, tuloy mo po.
Wala na. Okay lang.
Okay. Ayun. Sir Michael, tulad ng sinabi ni Doc, di ba, overthinking, spleen din yun. Kasi sa ano ng thinking, spleen yung nagdi-deplete yung energy. Kaya pwede ka rin magka-pimples pag sobra ka nag-iisip. Madi-deplete yung chi. Okay po.
Okay po, salamat po. Thank you
So,
for that.
sa protection po tayo ng sayang. So kung mahina po yung protection ng ating yang, ang immune system din ay hihina kaya nagkakaroon ng recurrent infection. Tapos nag-worse po pag climate ay nagbabago-bago. Yan, yung madaling sakitin. Pag uminit, lumamig, sinasakit na. As in respiratory infection, this would mean that protection is poor. Yan. Lalo ba 'di ba yung weiqi, lungs ang yung nagaano doon, nagdi-disperse ng mga weiqi natin. So kung weak ang ating lungs, yung protection niya, yung pang nangyari. Okay, next is substance. Pag titingnan natin is substance is yin. So thickness of hair. Yan, yung kapal ng buhok, skin,
Ayoko
body
na
weight
topic yan.
po.
Hindi ko gusto yung topic na yan.
Dahil Doc, Doc, mamaya kayo magkwento kung bakit. Quantity of food, mucus, stool, urine, anything that could be qualified. Example, excess mucus. Pag excess mucus, ang langiyin niya ay excess din. Kasi di ba yung yin nga, siya yung nagpo-produce din ng mucus pag excess. Excess head hair, ano yung makakapal ang
Let
buhok?
me interrupt, I'm sorry.
Sige po.
This should be decreased head hair, no?
Decrease.
Decreased head hair, that means, no, I'm sorry. Ibig sabihin, yung kidney yang mo, kukonti. So pag
Konti.
kidney yang mo mahina, kidney yin
Marami
mo.
kang buhok.
Ha?
Makapal ang buhok pag mahina ang kidney yin, Doc? Tama ba itong illustration natin? O mas
Alam
nakakalbo?
ko pag mahina ang kidney yang eh. Ay, oo, pag mahina. Pero bakit kumapal yung buhok? So ibig mo sabihin, okay, yeah, I know. Ibig sabihin, when you say kidney yin, kakalito, no? I think there's something wrong with this. But anyway, let's just continue po.
Baka napalit lang po. Kasi pag mahina yung kidney yin, yung nutrition, di ba, kung titingnan natin yung kahit sa nutrition din, circulation ng blood, pag mahina, hindi niya mararating yung lahat ng ng ulo, kaya mas manipis siguro to. Hindi siya makapal.
Okay.
At saka yung mga nalalaglag yung buhok, ito yung Doc siguro. Parang nagkaroon ako ng pasyenteng ganito po, may kidney yung deficiency. Nakakalbo yung mga gilid ng niya, yung nagkakaroon siya ng gilid ang buhok. Pero nung umokay na po yung kidney niya, tumubo uli.
Yeah.
Kaya ayaw ni Doc Hector pag-usapan yan.
Okay naman ang buhok ni Doc.
Can we move to the
Natabunan
next
ba?
topic?
Nakita ko naman yung buhok mo, Doc. Parang okay naman. Tinabunan mo lang po
Ba
ba?
ako napunta dyan? Okay, next na po.
Magtutusok si Doc ng kidney. Okay?
Hindi mo nakikita yung likod eh. Okay, sige, go.
Ay, yes ma'am Nits. May pasyente po akong ganyan.
Ay,
Nung umokay na yung kidney, kasi yun ang problema niya. Kahit ano daw ang hinahaplas niya, hindi talaga tumutubo. Tuloy-tuloy na nalalaglag. Pero nung na-diagnose nga natin na yung kidney niya may problem, doon ko po tinusukan. Tapos yun, unti-unti talaga makita mong tumutubo yung buhok.
Wow.
At tumigil po yung paglaglag. Tumigil. Ibig sabihin talaga, yung chi, umu-okay. Yun po yung sign din na tama, kung pagtama ang panggagamot natin, yung complaint ng pasyente na address natin. Okay po? So, sa function, meron pa pong tanong?
Wala po. Wala.
Okay. Sa function po ng yang, hyper or hypofunction of organs. Hyper, nagkakaroon ng hyper. Dahil nga yang, hyper. Pag hypo, di ba, mas yung hypo, dito siya sa yin kasi babagal. Ano, Doc? Frequent and urgent stools.
Oh, I think
Colon function.
Yeah.
Pag nag-i-increase yung colon function, dahil yung yang mo ay okay, so talagang ilalabas mo. Magkakaroon ng lakas yung colon eh. Kaya yung mga dapat niyang ilalabas. Kaya di ba sa colon time, babangon ka na talaga para pumunta sa CR. Kung okay yung energy ng iyong colon. Decrease in urination and edema. Kidney yang function. Pag nag-decrease ang urination at nagkaroon ka ng mga pamamaga, yun, yung function ng kidney ay humihina. Kasi alam naman natin yung kidney, diba, dun sa mga unang discussion natin, siyang namamahala sa ng water natin, sa katawan. So kung mahina yan, idadump niya, nagkakaroon ng dampness, kaya nagkakaroon ng mga pamamaga. At kung may yang, yun, ang ihi mo ay konti. So ayan pa ibang explanation ng yin and yang. So ang yin and yang ay oppose each other and can only be defined relative to one another. Oppose, di ba yung tulad kanina sinabi natin, may gabi, may umaga, may init, may lamig, opposition. Tapos transform into other, mutually consuming and controlling one another. Explain na rin po siguro to kung may tanong po or addition, mag-add na lang po. So, yin characteristic at saka yang characteristic. Madali din pong unawain to at dapat po talaga laging natandaan. Pag yin is dark, yang light, night, day, cold, heat, winter, summer, rest, activity, inside, outside, water, fire, slow, rapid, solid, vapor, contraction, expansion, chronic, disease. Pag sa yin, mas chronic. Pag yang, acute. So, yin internal, yang external organ, ang mga external organ natin. Pag yin, yung front, di ba sa harapan sa ng katawan po ito, front, tapos yung ay back, ang yang. So, torso, tapos limb. So, pag yin ay zang, at pag yang ay yung fu. Yung mga fu. So, blood and body fluids ay yin, at ang yang ay qi. Kasi yung sa ng movements. Relative stasis, evident motion, downward, inward, upward, outward, pale complexion, fluid complexion, lack of thirst. Pag yin, lack of thirst. Pag yang naman ay uhawing ka. So pag yin, yun, hindi maiingay. Mahinang boses. Pag yang ay yan, yung mga sumisigaw. So alam natin yung mga pasyente natin. Tsaka mismo tayo. So yin, deficiency symptoms. Pag yin ay may low-grade fever, late afternoon, red cheeks, restlessness, insomnia, night sweating, red dry tongue, rapid floating pulse. Pathologies, yin deficiency with empty heat, collapse of yin, clear yang, not ascending. Sayang naman, deficiency symptoms, siyempre, dahil nga kulang ang init, kaya merong chill, nag-chill.
Yes, sir. Just 1 hour, okay?
Itanong po?
Okay.
Okay, thank you very much, Ma'am Mildred. So
Wala na
masyado
pong tanong?
Oo.
Thank you po.
Madali naman pong unawain yung yin and yang di ba? Yun ang foundation natin.
Yeah, maraming salamat, Ma'am Mildred. So we
Okay
will
po.
continue with
Thank you po.
Yin and Yang on Monday. Maraming salamat po. Okay. If there are no questions, tuloy tayo sa tongue diagnosis. I will take over because may bisita daw po si Ma'am Teresita. Hindi niya maiwan-iwan. Okay? Now, ang topic is wet and slippery coatings. Continuation po ito last time. So, we continue with the tongue pictures. O, tingnan niyo po, very pale. So, masyadong maputla. And the key word here, slippery white. Thick coating. That's very, frequent bouts of diarrhea, shortness of breath, tiredness, feeling of heaviness. Ito masyado na tong very, very dampness, di ba? Inability to fall asleep. Okay? Okay, background to disease, mahilig kumain ng mga sushi, raw food, mga kinilaw, excessive physical activity. Alam niyo ba, pag excessive physical activity, nagdi-diminish din po ang chi. So there is such thing as overdoing it. Diba? So syempre, what will happen? For all you know, lalo kang nagkakasakit. Excessive use of sauna. Remember, when you use sauna too much, you sweat a lot. And so, nagiging deficient ka rin. And the sweat is related to blood, right? And of course, kasi mainit so nade-dehydrate ka. So, kaya yun. Spleen deficiency nito, ang diagnosis, because as you can see, the tongue is very pale, right? And then, long-standing, cold dampness na nag-transform into phlegm. Okay? So it's very phlegm now. Okay, why? Because it's sticky. No? At saka a bit rough, kung nakikita nyo. Okay. So case history, Mr. P, 54, suffered bouts of diarrhea. Stools watery but not particularly smelly. So bakit ito sinabing hindi smelly? Because hindi siya damp heat. He was very tired, so very deficiency. Even though his body felt heavy, he still forced himself to exercise a great deal. No, lalong lumala. After his daily training program, he used the sauna. In order to stay fit, he chose a diet consisting mainly of salads and fruit. So meron din siyang difficulty falling asleep. So this is very blood deficiency. Pero pag nakatulog na siya, he slept well. So you have to be very, like when you ask questions like this, how is your sleep? Okay naman. But you have to be specific. Like, does it take, will it take long for them to sleep? About 2 hours, but 3 hours. Tongue was pale, slippery, thick white coating. Pulse was frail and submerged. So masyadong malalim. Excessive physical activity and consumption of raw foods. Magwiwikan po yung TNT ng spleen. Transformation, transportation. So, ibig sabihin nagkakaroon ka ng spleen chi deficiency. Take note, excessive physical activity. So, fluids will accumulate and this will turn to dampness. So nag-transform. This will manifest in the loose stools and then there is feeling of heaviness in the body. Pale tongue body with a slippery white thick coating and weak pulse of very deficiency. Inability of Mr. P to fall asleep was caused by heart blood deficiency. Due to both insufficient blood dahil po sa spleen deficiency and excessive sweating. Excessive sweating because there's heat, this will injure the blood. Another case is 40-year-old female, pale tongue, swollen, slight teeth marks. I think you're very familiar with this already. Wet, white, thin coating, thin, pale yellow coating in the posterior third. Acute stomach pain as if a stone were lying in the stomach. Nausea, depressive moods, tiredness. Western diagnosis, fibroadenoma of the left breast. Background, long-standing emotional problems, irregular eating habits. So, Chinese diagnosis, as you can see, napakalaki ng swollen ng tongue, spleen deficiency, may teeth marks, no? Accumulation of damp cold, retention of dampness in the lower burner.
Sir, question, sir.
Yes po.
Sir, yung previous, sir, if there is retention, if there is dampness, why is the coating yellowish?
We
Which is
usually
a sign
see,
of it.
no, the coating here is at the back, posterior third. And take note, when you look at a coating, kasi matanda yan eh, posterior third. That's a normal, sabi nga dito, tofu. So it doesn't necessarily mean there's heat. That's why you need to really look at the color of the tongue body. So do not confuse that with heat. And usually when you have like a situation like this, kung nakikita nyo yung tip ng tongue, hit in the blood. So there is a disconnect between the fire and the water. Fire is hard, so yellow din yung posterior third. So that means they do not benefit from each other. Okay? So nagkaroon siya ng disconnect. And rarely do I see kidney tongue coat, posterior third na hindi yellow. Take note, the age of the patient is still very young, 26. But because of yung kanyang diet na masyadong, no, I'm sorry, di pala, 40 na pala, 40. 40. Yun. It's thin, pale yellow coating.
So the
Not
thin
thick
pale yellow
coating.
coating the posterior third is not significant in this
No,
case.
no. Speaks a lot more about the kidney. Why? Because the heart doesn't really do so much. And I think it is something the emotional problems. Okay, kung nakikita niyo may fibroadenoma na po siya sa left breast. And when you have that kind of problem, this speaks a lot about phlegm, no? Or dampness. So we cannot call this phlegm because the coating is not particularly rough, no? And ang ano kasi dito, 'di ba, first we need to look at the color of the tongue body. It's very pale, swollen. No, siguro things would have been different. Yung nakikita nating yellow coating, the posterior third would have been more significant if we see a thicker coating, pale yellow coating, pale yellow eh. I would like to think of this as parang ano pa, although hindi naman siya ano ba to? We cannot say there is acute with invasion, but I think this is more of like nagkaroon siya ng talagang yin, sobrang yin dahil po dito. Irregular eating habits, long-standing emotional problems. So definitely there is dampness. And take note, so accumulation of damp cold. So we are looking at very, very damp, no? So kung nakikita nyo po, retention of dampness in the lower burner. And it's not exactly heat because, di ba, we would say there is heat or damp heat if the coating was thick at the posterior third. This one is thin and it's pale. So it doesn't, if titingnan mo kaagad, hindi mo masyadong mapapansin. Although I would look at talagang nagdi-diminish na po yung essence niya. Kasi masyado na siyang, kung nakikita nyo yung parang V-shape na yung ano niya, yung kanyang, and this represents the essence actually. But again, I would
Thank
like...
you very much, sir.
Yeah, thank you po. Kaya dito natin makikita, I used to be like, I would get confused, especially if we focus so much on the coating of the tongue. So, ibig sabihin, even if it's yellow, as long as the coating is not thick and the color of the tongue body is not red, no? Or, yeah. And the coating, yeah, yon. So, kasi nakaano dito eh. Una-una, the tongue body is swollen. Can you see that? So yung pa lang is already telling us, di ba? And take note, white thin coating, but it's wet, no? So there's a lot of yang deficiency. Masyado siyang cold na. So kung titingnan natin, this is very significant. Long-standing emotional problems. Nakaka-affect po talaga sa ano. Too much thinking, irregular eating habits. Actually, most of the women that I see na may issues sa breast, they usually have emotional issues. So I hope everybody will look at that, no? Thank you po, Dr. Gavino. Any other question? We don't mind staying too long as bago natin, himayin po natin isa-isa. Anyone else who would like to comment? So, dito natin makikita na una-una nating titingnan. Ako kasi, I would usually first look at the color of the tongue, then I would look at the coating. No? Siguro, it would have been different if the color was like red, and hindi ganito po ka ano yung tongue. Okay? 40 na pala yung patient. 40 na po. And also, I failed to mention, yeah, okay. if you look at yung sen ng patient, yung shen niya is talagang ano, I don't know if you agree with me. I read somewhere that one way of really looking at of determining the shen, aside from yung mukha ng pasyente, and also, yung is the tongue, the posterior third of the tongue, no? Yun. So obviously, ito yung siyempre long-standing emotional problems, you would see na medyo affected talaga siya sa emotions. Thank you po. Let's go to the next one. This one is a younger patient. Slightly pale lang po siya. So parang nag-uumpisa pa lang, swollen. Slight teeth marks. So puro slight. And red points at the tip and side. So this is very significant. You know why? Kasi nakikita natin na ang ano niya po, yung mga red points sa tip and sides. What is that telling us? Ibig sabihin, kinalaman ang weather. May kinalaman ang weather. Diba, we have learned before that if you see red points at the tip and the sides, that is still superficial. Hindi pa siya ano. And pag yung namula na yung gitna, meron na mga dots. Internal na po siya. But if you look at this, meron na po siyang mga, shall we say, yung nag-i-invite ng pathogen because tingnan nyo naman, binges of eating sweets, overweight, ano pa? Humina yata yung signal. Walang Western diagnosis, so sadly. And then irregular eating habits. So kung nakikita nyo po, importante po talaga yung kanyang background, no? These things you have to ask, especially if you see this kind of tongue, no? Kasi they will not tell you eh. Sometimes they really wouldn't tell you unless asked. Okay? Excessive consumption of sweets, irregular eating habits, yung mga ganon. So slight spleen deficiency, accumulation of dampness, heat in the blood. Acute invasion, damp cold transforming into damp heat. So remember, damp cold can transform into damp heat if persistent. Okay. Now let's go to the next one. 67. Ito medyo maedad naman. Female, pale, swollen yung right half ng tongue, obviously. Tingnan nyo. Slippery white thin coating. Tapos, wait lang. Cough with white thin mucus, frequent urination. Now this is very common. Yung mga may notch sa tip of the tongue. Oh? Let's see what this means. Okay? Let's take a look kung ano ibig sabihin nito. Oh, mahina. Dali lang po, I think. So Western diagnosis, coronary heart disease, physically overworked for many years, hardworking condition, smoked for 40 years. So good luck. So spleen and lung deficiency, dampness, obstructing the channels. Dali lang po. Mabasa yun. Any comment here? Mukhang tahimik yata ang mga people. Okay. Physically overworked for many years, hardworking conditions, smoke for 40, matanda na siya. Spleen and lung deficiency, dampness obstructing the channels, accumulation of damp cold, heart, chi, and blood deficiency. Okay, ganito, let me tell you this. If you see a notch there, that's definitely a deficiency condition of the heart. No? So in this case, it's qi, heart qi deficiency. Okay? Of course, if you have heart qi deficiency, you will also have blood deficiency. Diba? It follows. So symptoms niya, cough with white thin mucus. The color of the mucus is kasi pag yung cough niya, yung phlegm is yellowish, then medyo siya, hindi siya that could tell us a lot about the etiology, no? Frequent urination, lack of appetite, dry mouth. So what do you think is the dry mouth here about? Hindi naman siya thirsty, dry lang yung mouth. So this speaks a lot about the
Dahil baka Doc yung may lang Chi deficiency siya, yung
yes.
colon is din niya, partner organ na responsible din sa ng lips. Diba?
So kung napapansin nyo, talagang magkasabay si spleen and lungs, no? So maraming salamat po. If there are no questions, alam ko inaantok na po kayo. Thank you po. Sir Michael, do you have any now? Is everything getting clearer now?
Yes, no. Yes.
Di pa siya masyadong clear. It takes a lot of tongues. So every time you see someone, look at the tongue, just like my friend, Dr. Ryan. Let me look at your ano ba binagawa? Kita ko naman ang picture. Gawin nating trend yon, no? And para we can be better diagnosticians. Kasi if you do not know how to diagnose, you cannot be a good clinician, no matter what you do. Okay, next we go to... okay. Punta na tayo sa diagnosis by interrogation. Let's call on Ma'am Vina Pasqua from Baguio. Good evening po.
Good evening po, Doctor. Good evening po sa lahat. So, continuation po ito kahapon. Day 4 na po itong limbs. Ngayon, excuse me po, 3 more of limbs po tayo. So, ito yung panginginig. Three more of the limbs always indicates liver wind. So, kailangan po nating establish yung source ng liver wind. And ito ba ay full or empty wind? Ang root cause po ng liver wind may be heat during an acute febrile disease. Liver fire, liver yang rising, a deficiency of yin of the liver and or kidneys, and liver blood deficiency. Last two types of wind are of empty type and all the other are of the full type. Pag full wind po, it is characterized by pronounced tremors or convulsions during an acute febrile disease, whereas empty wind is characterized by the fine tremors or tics. Ito yung involuntary movement of muscles. So liver wind, full type, pronounced tremors, convulsions, vertigo, unilateral numbness of the limb. So ang pulso po ay wiry. Pag empty type naman, fine tremors, tics, mild dizziness, tingling of the limbs. Ang pulso po dito ay choppy or fine and slightly white. So meron po tayong case history po dito. 46-year-old man. He had been suffering from a fine tremor of his right arm for 3 years na po. So nagpatingin na po siya sa neurologist who excluded the diagnosis of Parkinson's disease. Itong pasyenteng ito had very few other symptoms, complaining only a feeling of heat sa kanyang ulo. Malamig po ang kanyang paa at kamay, may flutters, at paminsan-minsan kumakati po ang kanyang left eye, and occasional heat and dryness sa kanyang dalawang mata. Ang kanyang skin was tuyo po, and he had been suffering from myopia. Ito yung mahina ang paningin sa malayo from the age of 8. Ang kanyang katawan po ay, it was a mixture of metal and wood. So metal element lungs and wood is liver. His tongue was slightly thin, was so red po sa sides, and wala pong sufficient coating on the center. Ang pulso po niya was slightly wiry on the left, at saka mahina po sa right, mostly on the lung position. Ang diagnosis po nito is yung tremor of the arm is an unmistakable sign of liver wind. And we should establish po yung root pattern giving rise to wind. Sa kasong ito, it is liver blood and liver yin deficiency. Ang symptoms po ng liver blood deficiency are floaters, each of the left eye, dry skin, myopia from childhood, and the weak pulse sa right po. So yung dryness po ng kanyang mata at saka yung kulang po ng coating sa kanyang dila indicate liver yin deficiency. May mga ibang symptoms po of liver yang rising, yung pagkakaroon niya po ng yung pakiramdam na mainit ang kanyang ulo at saka yung kanyang mata, red sides of the tongue. And yung liver chi stagnation niya, ito yung cold hands at saka kanyang paa. Ang wiry pulse naman may be related to any of the full liver patterns. Kasi in liver disharmonies, it is not unusual to have a combination of several different patterns. At wala naman pong symptoms or signs corresponding to the weakness of the lung pulse, which is not unusual for this organ. Pag yung lung pulse is the weakest of all the pulse position, ang sabi po ng author, I usually relate this to emotional problem due to sadness and grief po. Kasi alam na po natin na yung lungs are grief ang ano niya. So meron po tayong case history dito na isa. A 45-year-old woman had been suffering from a fine tremor of the left arm for 1 year. She also experienced numbness and tingling of the left arm. So, kunti lang daw po ang symptoms except for yung kanyang period po ay scanty. Quite scanty. Ang kanyang dila was pale and slightly thin, and her pulse was fine and wiry. Sa patient po na ito, ang kanyang diagnosis ay, ito ay example ng empty wind deriving from blood deficiency. The blood deficiency is evident naman sa pale at saka manipis po ang kanyang dila and fine pulse. And the wind is evident from excuse me, the wiry pulse and obviously yung panginginig sa kanyang arm. So yan lang po. Thank you, doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Sir Michael, do you remember yung patient natin na taga Bicol? When we did the Aculift, napansin mo, guminginig yung kanyang
Yes po.
nagkaroon siya ng tics. Di ba yung itsura niya, Yin deficiency, di ba?
Yes po. Yes po.
So dapat na-resolve yun. Nakafocus tayo sa ano eh. So hopefully, we would, pero inano na natin yung liver, di ba napansin mo, lumala siya, parang nilabas niya. Oh.
Opo, opo.
Oh, so, dapat tuloy-tuloy yung Aculift. Maganda, di ba? We use liver.
Pero meron tayong ginawa, Doc, na ano yung sa grounding eh. Possible na nakatulong yun. Pero sabi nga, kailangan talaga i-continue po yung yung treatment.
Totoo. So, nakita mo yung itsura ni ma'am, medyo payat, single. Saka may hugot din siguro yun, no? Wala man siya dito ngayon. Kilala ni Dr. Gavino yun taga Bicol. Si Ma'am Ja. Ay, sasabi ko na tuloy. Anyway. So yun, punta na po tayo bago yung bunganga ko medyo marami na masabi. Let's now go to Paul's diagnosis. Let's welcome Sir Dino.
Thank you po.
Yung audio nyo, sir. Sir Dino? Wala po kayong audio. O baka ako yung walang audio.
Si Dino po hindi marinig.
Sir Dino, wala po kayong audio.
Yan, Doc, meron?
Meron na.
Ngayon lang.
Okay.
Akala ko kasi yung signal ko mahina. Sorry.
Ano, wala, Doc. Sige na. So, ang topic natin is hidden pulse. So, the hidden pulse is simply an extreme case of a deep pulse. It is deeper than the deep pulse and can be felt only with a very strong pressure at the very deep level near the bone. So, kumpara sa deep pulse, mas malalim po ang hidden pulse. The hidden pulse is similar to that of the deep pulse. It simply means that the condition is an interior one, and its clinical significance depends on its association with other qualities, especially kung full or empty ones. However, the hidden quality always indicates a blockage in the interior, especially when it is the full type. Sa blockage, in this case, means that the pathogenic factor is large, deep in the interior of the body. So, merong blockage. It is locked inside and difficult to expel. So, an example dito is depending on its association with other qualities, the hidden pulse could indicate block stagnation of qi, block blood stasis, block heat in the interior, block cold, block chronic pain, block phlegm, or block retention of food. The most important distinction to make is whether the hidden pulse is the full or empty type. When the hidden pulse is also empty type, it indicates severe Yang deficiency. So, sa hidden pulse indicates that the pathogenic factor is blocked deep inside the body. Example of such pathogenic factor are qi stagnation, blood stasis, heat, cold, phlegm, or retention of food. Sa common condition presenting with hidden pulse include digestive disease, blood stasis, abdominal masses, heart disease, and vomiting. So, yun po yung mga condition. According to Dr. Shen, the hidden pulse is in apparently healthy people indicates a lifestyle of overindulging in drugs and sexual activity. He pinpoints the age to which this lifestyle refers according to the degree of the hidden pulse. Pag ang pulse daw is very hidden, it indicates that lifestyle occurred between birth and 15 years old. If it is slightly less hidden, between 15 and 20 years old, if even less hidden, after age 20 naman. So, ulitin lang, according to Dr. Shen, the hidden pulse is seemingly sa healthy person. Pag healthy po yung condition ng tao, may indicate overindulge in drugs and excessive sexual activity in the past. Summary of clinical manifestation, pathogenic factor in the interior, yung po yung hidden full. Pag severe Yang deficiency, hidden weak naman po. Sa combinations, we have hidden full indicates qi and blood stagnation, retention of food, or internal cold or internal heat, depending on whether the pulse is slow or rapid. So, pag cold, slow, pag heat, rapid siya. Hidden empty naman indicates severe Yang deficiency with internal cold. Pag hidden rapid, indicates interior heat, which may be full or empty heat depending on whether the pulse is full or empty. Sa hidden slow indicates interior cold. Sa differentiation of similar pulses, pag deep, the deep and hidden pulses are not significantly different because the hidden pulse is simply an extreme case of deep pulse. Sa short naman, the hidden pulse is very deep and difficult to feel, but it occupies its normal pulse position, whereas the short pulse does not feel its pulse position kasi masyado maikli. Sa clinical significance in its position, front position, retention of food in the chest, stagnation of qi, retching, uncomfortable sensation in the heart region. Sa middle position, abdominal pain, feeling of heaviness of the body, and weakness. Sa rear position, severe hernia pain. So, thank you for listening.
Thank you very much, Sir Dino. So
Thank you
from
po.
pulse diagnosis, punta naman tayo sa differential diagnosis. And you will love this kasi ang topic niya is kidney essence deficiency. Good evening, Ma'am Needs.
Good evening, Doc Hector. Good evening, everyone. Yeah. How's my audio, Doc?
Very clear po, Ma'am.
Thank you, Doc. Okay. The topic for today in our TCM Foundations number 159 is kidney essence or Jing deficiency. Okay? Kidney essence, as we know, is not replaceable once lost as we age. But we can preserve it by having a healthy lifestyle, nourishing our soul, keeping a calm mind, and having a purpose. Okay? Essence is stored in the kidneys, but also circulates all over the body, particularly in the 8 extraordinary meridians. Okay? Essence is made of congenital chi and lifestyle. Essence is very difficult to replenish kapag iyon ay nawala na. Okay? Kidney essence or Jing deficiency usually involves deficiency of kidney yin and to some extent kidney yang. Its signs manifest in relation to growth, development, reproduction, sexuality, bones, marrow, the brain, the teeth, memory, and hair. Remember, poor hereditary constitution in children, aging, excessive sexual activity, and kidney yin or yang deficiency over a prolonged time may lead to the decreasing of kidney essence. Okay? Sa mga bata, this pattern is almost always caused by a hereditary weakness. It can be due to parents being too old or in poor health at the time of conception. Okay? The typical manifestation is poor bone development and late closure of fontanelle. Ano yung fontanelle, Doc Romy? It is because the essence is essential in generating marrow and nourish the bones. For the same reason, this pattern can lead to bone softening as well as knees and leg weaknesses for adults. Okay? The deficient kidney essence fails to fill the brain with marrow, hence the symptoms of retardation for kids as well as poorer memory and decreased mental sharpness for adults. Okay, medyo bobo ba yung tawag dun? Hindi naman. The essence is also responsible for the hair growth. Therefore, the lacking of essence gives rise to hair loss or premature graying of hair. Marami tayong meron yan. Finally, the kidney essence is the essential element in terms of healthy sexual function. Therefore, this pattern causes all kinds of sexual inability for both women and men as well as infertility and sterility. Okay? So, ang etiology ng pattern na to, long chronic illnesses, overwork over long period, poor development at the fetal stage. Okay? Accompanying pathology, kidney yang deficiency, kidney yang deficiency. Okay? Sign and symptoms, nag-ano na tayo kanina. Ito yung summary. Impairment of intellectual function, osteodystrophy or poorly developed bone structure, dizziness, tinnitus, weak, aching back and knees, infertility, impotence or lack of libido, loss of head hair or premature graying, loosening of teeth. So sa mga bata, retarded growth and development, short stature, sluggishness of physical movement, low intelligence, weak bones, retarded closure of fontanelles. So sa adults, premature senility, weakness of legs, difficulty in walking, dullness of spirit, slowness of physical movement, mabagal maglakad, kumilos. Okay? Ang pulse, floating, fine, empty, and leather. Tang, kapag tinignan nyo, red without coating, minsan naman pale. So, it's either. Treatment principle, supplement kidney essence, bone marrow, kidney yang, enrich the kidney yin. So, ito yung mga acupuncture points na gagamitin natin. Bladder 23, bladder 52, kidney 3, spleen 6, GB 39, needle with supplementation. So, pipili kayo dito sa ibang points na dadagdag nyo kapag may dizziness, DU20 and DU16, governing vessel. Pagka may tinnitus, SJ17, Sanjiao 17, gallbladder 2, Sanjiao 3. Okay? Kapag may lumbar pain, GV3, bladder 40, and bladder 60. Okay? Sa seminal emission, kidney 12, ren 6, heart 7, and stomach 36. Okay, sana remember nyo po yung points. Thank you very much. I hope you learn. Questions po.
Thank you very much, Ma'am Needs.
Thank you po.
Thank you po.
Did you learn a lot, Sir Michael?
Yes po.
Okay. Now let's go to Dr. Gavino for another topic, a new topic on acupuncture patterns and practice.
Yan.
Not very familiar with this. It's called strangulary. I don't know if I pronounce it right. Good evening, Dr. Gavino.
Tanggil.
Magandang gabi po sa inyo lahat. This is a new topic, strangulary. Strangulary sounds very highfalutin, but actually, sandali sir, ako nawala. Strangulary, okay. Strangulary is just in medical parlance, it is a condition caused by blockade or irritation at the base of the bladder, resulting in severe pain and strong desire to urinate. In plain language, UTI lang po ito. Kaya lang sa TCM, hindi basta-basta UTI, and we differentiate the different causes of this strangulary. The etiology is blockade or irritation of the base of the bladder, and the symptoms are severe pain, strong desire to urinate. Clinically, you will see frequency. Ang frequency po yung madalas umihi ng unti-unti. Urgency, hindi mapigil. When you got to go, you got to go. Hanggang sa maihi po kayo sa lawal. Dribbling, papatak-patak ang labas ng ihi. And dysuria, masakit pag-ihi. Even before or during urination. This is usually associated with pain radiating to the abdomen, waist, and lower back, with tightness and pain in the lower abdomen. Symptoms may vary in intensity and may come and go. Ang example po nito, cystitis, urethritis, in short, affliction of GUT, genitourinary tract. In Chinese medicine, the etiology is stagnation of dump heat or kidney deficiency. The main pathology is like this. Kidney deficiency will produce failure of transformation by the bladder, resulting in accumulation of damp heat in the bladder. However, due to the internal and external relationship of the two, and the kidney strength influencing the kidney transformation and opening of the bladder. So weakness in one will result in weakness in the other. Ibig sabihin, if you have kidney deficiency, then you're going to have bladder symptoms. Ang bladder symptoms will also cause kidney deficiency. Kaya paikot-ikot lang. Habang hindi gumagaling, habang hindi ginagamot, palala ng palala. There are 9 patterns of disharmony in strangry in Chinese medicine. And number 1 is heat strangry. This is manifested by symptoms of frequency and dysuria and cramping pain in the lower abdomen, radiating to the lower back, plus symptoms of damp heat. Alam po ba natin ang symptoms ng damp heat? Hello, anybody? Do we know the symptoms of damp heat? Mr. Rivera, can you cite me, maski isa lang?
Damp heat.
Yes, damp heat. Can you give me one symptom? Mawala. Mr. Rivera.
Hindi na ang signal.
Yun po. Damp heat. No
Damp
po,
heat. Damyo, sabihin mo. Yun ang symptom. Okay, I'll give you a hint. Anong kulay ng urine? Maputi ba? O hindi?
Hindi po.
Ah?
Hindi po.
So it's going to be dark in yellow.
Yes,
Okay.
dark in yellow po.
Oh, because there is heat,
Po siya.
mangyayari sa lalamunan mo, maglalaway ka ba?
Opo, parang ganun po siya.
Maglalaway ka because there's heat? O manunuyo?
Dry dock.
Nanunuyo po. Sorry po,
Yeah,
nanunuyo po. Kasi may heat po siya eh.
Ang taste ba in the mouth will be bitter or sweet?
Bitter po.
Oh, good. May fever ba ang chills o wala?
Meron po.
Okay. At saka ito'y magtatae. Tama?
Tama po.
Mali. There is heat.
Magtatae po, di ba? Kasi heat.
Pagka heat, matutuyo ang tayo mo. Anong nangyayari sa tayo mo pag tuyo?
Dry.
Ito ako ha. There will be
Mahirap magpupo. Mahirap magpupo. Parang gano'n. Mahirap magpupo. Dry. Parang constipated po.
You're going to be constipated.
Mm-hmm.
So those are the common symptoms of damp heat. Dark and yellow green, dry throat, bitter taste in the mouth, sometimes associated with nausea and vomiting. You may have fever and chills, and you're going to have constipation. The tongue would be white with
Tongue-coated water.
huh? Is the tongue going to be white or red?
Red po.
Yeah, you're good. Ang coating ay puti na makapal.
Opo.
Mali. Heat. Anong kulay ng tongue coating pag may heat? Puti ba o dilaw?
Tongue-coated. Tongue-coated. Yellow. Yellow po. Yellow po.
Yellow. At kung may dampness, ito ba ay wet, greasy, or dry?
Greasy
Good,
po.
very
Greasy.
The tongue would be red with yellow and greasy coating. And the tongue would be slow, right?
Opo.
Anybody would like to contradict what Michael Rivera said? Na kung may heat and may pulse is slow.
Rapid po yun. Sorry naman po. Kasi hit na po yun eh.
Nagtatawanan mo ako, ha?
Nagtatawanan po niyo ako eh.
Ay. Okay. So, our diagnosis is heat stranglery or damp heat. The treatment protocol would be, siyempre, clear the heat, there's dampness, drain dampness, and meron siyang dark yellow urine, which I think is scanty, so we have to promote urination. And there is abdominal pain, and so we have to stop the pain. Would you like to discuss the acupuncture points?
Sige na po, turuan po niyo ako.
Hindi, babasahin na lang ito, bibigyan lang ko summary. Most of the points are for clearing the heat and dampness. Example, stomach 44, liver 2, T5, all clears heat. Yung dampness naman, stomach 44 will also do that. So also spleen 9, LA11 will also expel dampness. But one thing that I notice here is most of the points harmonize the jaw, the lower and the middle jaw. Like spleen 6, harmonizing the lower jaw, spleen 9, harmonizing the middle jaw, and also bladder 28 and bladder 22. They all regulate the jaws. Okay? I'll just enumerate this. Stomach 44, liver 2, spleen 6, spleen 9, and bladder 39. Regarding bladder 39, saan ang location nito? Would you know?
Sa likod.
Alam ko malapit sa bladder 40.
Tama po. Bladder 40 malapit niya sa ibaba po ba? Ilalim? Ibabaw? Pag nakaliwa ba ng kanan?
Hello? Tingnan ko ha. Google na kayo.
Kung hindi po natin
naalala ko parang sa tabi.
Oh yeah, sa tabi po. Sa tabi po ba sa ulo? Sa puwet?
Ano ba yan?
Bandang kaliwa o kanan?
Hindi ma-edit.
Okay, ako na po masasabi. It is one tune, medial to bladder 40.
Medial?
Medial po. Medial to bladder 40, not lateral. Sa tabi nga.
I'm sorry, yeah, okay.
Isa pang hindi natin madalas encounter is stomach 28. Would you know the location of stomach 28?
First, you need to know the location of stomach 25.
Are you telling something?
Yeah.
Sa may bandang puson po yun.
Opo, oo.
Okay. It is two-tune lateral to REN4. And where is REN4? In relation to the navel. How many tune down?
Yeah, nandito.
Is it 3 or 4 tune?
3 tune.
3 tune.
3 tune, po. REN4, remember, REN4 is 3 tune, baliktaran lang. REN3 is 4 tune. So baliktaran lang.
Actually, ang ano ko po dyan, di ba mas popular si stomach 25, lateral siya sa tutsun lateral sa REN8. So, 8 minus 4, ay, mali pala.
Hindi, ganito lang po aking palatandang ganito. Baliktaran, REN4 and REN3. REN4 is 3 tune below.
Okay.
REN3 is 4 tune. Baliktaran sila.
Ay, oo, baliktaran nga.
Yeah.
Galing.
T5 and LA11, alam natin. Saan po ang bladder 22? The Sanjiao Xiu.
Yeah. Actually, sinasabay ko yan pag tinutusok ko si bladder 23. Madali na ilok.
Kasi po, tabi po ba sila?
Sa taas ng...
Okay, so it is in lumbar 1, first lumbar vertebra. And bladder 28, Pangguat Xiu. Sir, ano po ibig sabihin ng Pangguat?
Ay, si ano tanungin nyo? Si ma'am ano? Asan na ba si? Ay, wala.
Kung pa ibig sabihin ng pangkuan, where is it located?
Ladder 28.
Opo. Sana po. Pangguanshu is bladder shoe.
Second posterior sacral forearm.
Tama po. Tama po.
S2.
And that concludes our Boodle time.
Ay,
Any
wow.
question?
The most
Franco?
awaited Boodle time.
Boodle
question.
time.
Sa Tagalog ito, balisaw-saw lang eh.
Oo nga eh. Saka ano I'm sure excited na po kayo. Ano tayo ng balance method next week. Ang ganda nun.
Ay sir, di pa pinadadala sa akin kung ano yung ipa-plus mo.
Di ko pa nga nagagawa eh.
Excited kami doon, ha?
Tayo dyan.
Diyos ko naman. Parang naman. Sige, baka Saturday. Okay po.
Sige sir, pero ano lang po.
Thank
It's going
you.
to be difficult. It's
Yeah.
going to be difficult.
Yeah, well, we'll do it your way because I think it's more effective. And
Yes, po.
Kasi,
this
ang
time
sinasabi
people
ko lang,
uh-uh.
it's going to be difficult for them
If they will
to
not,
understand, comprehend, and remember
yes.
kung hindi po alam ang horary cycle, that's the flow of chi, at saka location of the channels.
Yes. So we have already discussed the
Kung
horary
hindi
cycle.
po alam, kakahirapan po tayo.
Opo. Oo. Siguro gawin po natin 'yon for the first episode, no?
At saka ang suggestion ko sir, meron silang cheat sheet sa harapan nila while we're discussing it. Cheat sheet ng horary point, horary clock, at saka cheat sheet ng ng channel
Okay.
channel location, and going to be easier to.
And try to use the Chinese parang
Chinese name.
Chinese name, yeah. Okay. And then understand bakit yun ang name nila, di ba? Yun eh.
Opo.
Bakit siya Tai Yin? Bakit siya Tai Yin? Kasi Greater Yin. Eh kung may Greater Yin, may Greater Yang din, Tai Yang.
Sir, ikaw na lang mag-translate. Hindi ko masyadong alam, sir.
Si ano ba yun? Si Ma'am Ke. Okay, maraming salamat, Dr. Gavino.
Wala pong question regarding this, Balisaw-saw?
Mukhang wala po. The balisaw-saw time. Okay. Sige, thank you po. And then...
Dr. Gavino, sa ba? Hello? Regarding po dun sa sa discussion po niyo sa susunod, mas better po ba aralin po yung 12 meridians?
Dapat kabisado mo yun.
Opo.
Hindi dapat aralin. Dapat kabisado mo pangalan, saan nagmumula, saan dumadaan, saan natatapos.
Opo.
Yes.
Ilan po, Dr. Gavino? Mahaba-haba
Sige.
po.
Kung nag-participate kayo, ma-appreciate nyo yung balance method. There are, I think, 5,
Very
6.
nice po yung discussion po niyan.
Maganda po yun, as in. So you have to
Pero
go.
lang, warning it's not going to be good for your practice if you charge by the needle. Kasi konting needles lang magagamit mo.
Kaya nga.
Hindi ka makakagamit ng 15 o 20.
Oo nga po. Very nice po ito. Very nice.
Kaya
Salamat
sanayin
po,
na sila. We don't go by the number of needles. Even if you charge 1.5 or 2K, isang dalawang needle lang siguro. And
very interesting part po.
Yes.
Okay.
So
Michael,
ka na lang para mas
Michael,
Opo.
pasyal ka
Ano
Sabado. Pasyalan mo ako Sabado. Kung may time ka.
Ay, po, may nag-invite po sa akin na medical mission. Somewhere in
Wow!
yes po.
galing.
Teka muna, saan ka magme-medical mission?
Sa General Trias po eh. Mga sa
Oh,
kulong.
layo.
Opo, ay
Okay,
mag-ano din.
that's very, very good.
Ay sabi ko, dadali ko na rin lang yung aking ano, yung aking quantum para kung sakaling mamali ako ng diagnose, meron akong quantum. Ay.
Oo. Oh, sige. Okay lang.
Sige po, baka siguro po the following week.
Marami naman
Dahil-
Saturdays di ba?
Sige.
Opo.
Okay.
Anong
Sige,
gusto
gusto
mo
mo,
ano, pasalubong, Dr. Bino?
Alam mo yung tayo?
Thank you, Dr. Gabino pala sa wine.
Thank you very much.
And the,
Thank you po, thank you po.
and the free cholesterol chicharon.
Uy!
Okay po ba? Okay po ba?
And the coffee. Okay siya, naubos na nga eh.
Kaya ba, meron po yan.
Yung pa lang,
Andito ka pa ba?
laki-laki kasi ng lalagyan, so nakita ng mga tao doon. So,
Ganun po
si
ba?
Albert
Hindi po
pa,
naman.
naku.
Dog Gamino, umiinom pa po ba kayo, Dog Gamino?
Ano?
Umiinom pa po ba kayo like wine, red
Red
wine?
Come on. Naglalasing pa ako.
Oh, go.
Halata
Oh,
naman
sige.
eh. Hindi halata.
Okay, sige.
Okay.
So, thank you, Dr. Gavino.
Sige po,
And,
thank you very much. Salamat po.
yeah, see you on Monday for the
Opo.
for the balance method. Thank you po.
Monday
Next.
na po ba?
Monday na po yun. Oo. There are 5 sessions. Okay. We will now go to signs and symptoms. Let's listen to Sir Alvin. Good evening, Sir Alvin.
Yes, dog classmates, good evening.
Good evening po.
Yes, sir, good evening. Pasensya na po, medyo mabagal. Naririnig po ba ako?
Dinig na dinig po.
Ay, thank you so
Dinig po.
much.
Very clear.
Kaya lang hindi lumalabas sa akin yung presentation. Paano ba yun?
Alvin, yung audio nyo po.
Yes, doc. Hindi nagpa-flash yung presentation sa screen ko.
Ay, ganun. Bakit?
Bakit kaya? Magla-log out muna ako, doc. Ayan, meron na.
Ang tagal naman dumating. Mukhang isang minuto.
Nawawala talaga.
Sige na. Okay na po. Hello? Are you still there, Sir Alvin? So yung topic po ni Sir Alvin is invasion of wind cold. So ano na lang natin to? Or can we go back to you later? Let's start muna with the other one.
Hello?
Okay. Sige po.
Yes, doc. Okay, so we're going to talk about runny nose. Okay, so in a full condition, meron tayong invasion of wind cold sa runny nose. Mga symptoms, signs, runny nose with profuse white watery discharge, itchy throat, acute onset, aversion to cold, fever, cough, slight breathlessness, stuffed or runny nose with clear watery discharge, sneezing, occipital headache, body aches, thin white tongue coating. Pulse niya is floating and tight. So may mga recommended acupuncture points like LI4, rifle burner 5, bladder 12, and lungs 7 for invasion of cold full condition. Invasion of wind heat, sa runny nose pa rin. Meron siyang yellow discharge, acute onset, red nostrils, aversion to cold, fever, cough, sore throat, stuff or runny nose with yellow discharge, headache, body aches, slight sweating, slight thirst, swollen tonsils, tongue slightly red on the sides in the chest area or on front part. Pulse floating rapid because of wind hit. So again, LI4, triple burner 5, bladder 12, lung 7, LI 11, yung mga recommended acupuncture points. Sa empty condition naman, lung Qi deficiency with empty cold, of course, runny nose, chronic runny nose with white watery discharge, sneezing, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating. Mayroon siyang dislike to speak, bright white complexion siya, propensity to catching cold, tiredness, dislike of cold because of lung deficiency with cold niya. And then, feeling cold, cold limbs, pale ang kanyang tongue with pulse, weak. This may be correspond to allergic rhinitis in Western medicine. So, acupuncture points, bladder 13, lung 7, REN 12, and REN 6. Of course, dapat may moksa kasi nga cold siya. Alright, so kidney yang deficiency sa empty condition, condition. Lower back ache, cold knees, feeling cold, bright white complexion, weakness, tiredness, lassitude, abundant clear urination, urination at night, impotence, decreased libido, pale and white ang tongue. Ang pulse niya is deep, weak. This may also correspond to allergic rhinitis in Western medicine. So acupuncture points, bladder 23, kidney 3, kidney 7, REN 4, SI 3, and bladder 62. All right. So next slide, please. Other patterns with runny nose, damp heat in the stomach and spleen, runny nose with sticky yellow, foul smelling discharge, facial pain, feeling of heaviness of the head, sticky taste, a feeling of fullness and pain in epigastrium and lower abdomen, poor appetite, thirst without desire to drink, may nausea, also damp heat, loose stools with offensive odor, a feeling of heat, dull yellow complexion, red tongue with sticky yellow coating, slippery and rapid ang pulse. Alright, so toxic heat in the lungs and stomach. Meron siyang runny nose with yellow, red and swollen nose. So bloody discharge, breathlessness, foul breath, cough, headache, swollen and red face, epigastric pain, thirst, tongue niya ay red with red points and thick, sticky, dry, dark yellow coating. Overflowing, slippery, rapid ang pulse. Okay? So, clinical note. Remember, a white, watery, running nasal discharge indicates allergic rhinitis, whereas a sticky, thick discharge indicates sinusitis. Okay, remember that.
Thank you very much, Sir Alvin.
Yes, Doc. Thank you
Camarines
so much.
Norte.
Yes, Doc. Thank you so much.
Okay, thank you po. Now let's go to the last one. Wala din po si Sir Aldrin. Meron po siyang appointment. So we will ask the kindness of Ma'am Vina Pascua of Baguio to take over. Good evening po, Ma'am Vina.
Good evening po ulit, Doctor, at good evening po sa lahat. So, anxiety, day 5, etiology po. The main etiology factor in anxiety is obviously emotional stress. However, meron pong other factors play a role too. And constitution and diet are important etiological factors. Itong emotional stress, anxiety is a general term that indicates a chronic state of fear and uneasiness. Parang ako yan. However, that does not mean that among the emotions, only fear leads to anxiety. A chronic state of anxiety may derive from maraming emotions po, and particularly worry, yung takot, yung sobrang joy, shock, guilt, shame, or pensiveness. And any of these emotions may lead to some chi stagnation initially. So after some time, yung stagnant chi generates heat, and with time, na-injure na po yung blood and yin, leading to blood o kaya yin deficiency. Therefore, yung heat may agitate the mind. Ito yung sanhi ng anxiety. On the other hand, blood and yin deficiency deprive the mind and its residents and also lead to anxiety. So yung chi stagnation and chi deficiency deriving from emotional stress may also lead to the formation of phlegm na nag-obstruct po ng mind at saka nagli-lead to more serious anxiety or panic attacks. So itong book po ng chapter 39, sabi of the simple question, sinabi po na when shock affects the heart, it deprives it of its residence. Yung mind naman has no place to return to. So yung isip po comes ceaselessly. So, and she becomes chaotic or chaotic. So dito nakikita sa figure na ito yung consequences of emotional stress. So pag itong emotion, magiging stagnation, chi deficiency. So sa chi stagnation, magiging heat o kaya phlegm. Ang chi deficiency, phlegm or blood stasis. Sa heat naman, magiging phlegm o blood stasis. Sa blood stasis, magiging phlegm. And then yung heat, magiging fire. Yung phlegm, yin deficiency. At saka yung fire, yin deficiency. At saka empty heat. Wala si Sir Aldrin na mag-explain ng maayos. So, constitution. So, sabi po ng author, in my experience, a constitutional tendency is an important and frequent etiological factor in chronic anxiety. So, marami daw mga tao who simply have a constitutional tendency to worry and anxiety for no apparent external reasons. So, ang sabi po niya, I have also, mapansin daw niya na there is often a familial incidents na nag-treat siya ng various members and even generations of one family. An important sign indicating a constitutional tendency to emotional stress and anxiety is yung heart crack sa dila. So according to the National Institute of Mental Health, yung rest po ng developing panic disorder appears to be inherited. So mana-mana. This confirms the importance of constitution in the etiology of chronic anxiety and panic disorders. So dyan po sa dila na yan nakikita yung comparison of heart attack at saka yung stomach crack. So sa una yung heart crack po. Pag sa stomach crack, mas malalim po sa stomach crack. Yan po yung pagkaiba niya. Irregular diet, itong pag-irregular eating po causes deficiency of qi and yin sa stomach. In the long run, nag-a-affect po ito ng heart at saka nag-lead po to heart yin deficiency and anxiety. So itong irregular eating and the excessive consumption of damp-producing foods nag-lead po ng formation ng phlegm at pumaharang po sa mind and aggravate anxiety and panic disorders. Sa loss of blood naman, pag marami pong nawalang blood, such as that which may happen during childbirth, nagli-leads din to blood deficiency. The heart governs blood, and this may therefore lead to heart blood deficiency and anxiety. Overwork din. Pag overwork, in the sense of working yung mahabang oras na walang pahinga ng ilang taon, seriously depletes kidney yin. Deficiency of kidney yin eventually affects the heart and may cause chronic anxiety. Deficiency of kidney yin may also cause chronic anxiety by itself without affecting the heart. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Nakaka-relate po ba kayo?
Opo, Doc. Ganun po ako.
Bakit meron din kayong crack sa gitna?
Merong hindi naman masyado, Doc.
Sino ba dito may heart crack? No?
Meron ako konti lang.
It doesn't mean na meron na kayong anxiety. Simply means bawal po kayo ma-stress. Bawal po kayo yun po yun. Yun yung tinatawag na constitutional tendency to emotional stress. Maraming salamat po, Ma'am Vina. Maraming salamat po sa lahat. And I'm sure gutom na po kayo. So, we will see you again later at 8 o'clock. Okay? For auxiliary treatments of low back pain. Maraming salamat po sa lahat. Good evening for now.
Thank you, Doc. Good evening.
Thank you.
Ito, good night.